Hello viewers, my name is Diane Tinglin and I'm doing a video presentation on technology and how technology helps children with special needs in the early childhood classroom. In the classroom, teacher will face multi types of exceptionalities. A child who has exceptionality has characteristics that deviate from the considered norm for physical and mental abilities. In this video presentation, I will be identifying two special needs, autism and intellectual disabilities. Hence, I will be researching on how technology can help assisting families with children with special need in the early years, as well as one's hardware or software that would promote learning for these children, and also include a resource and organization that are available for children that have special needs. According to URBI 2015, Development of Inclusive Special Education aims to provide a provision and guidelines for policy, procedures, and teaching strategies that will facilitate the provision of effective education for all children with special educational needs and disability. What is special needs? According to Merriam-Webster Dictionary, special needs are any of various difficulties such as physical, emotional, and behavioral or learning disability or impairment that causes an individual to require additional or specialized service or accommodation, such as in education or recreation. I will now look at two common disorders. Autism. Autism is known as a complex developmental disability. Experts believe that autism presents itself during the first 3 years of a person's life. The condition is the result of neurological disorder that has an effect on normal brain function and affecting development of the person's communication and social skills. Characteristics that identify among people with an autism: empathy, understanding and being aware of feelings of others. A person with autism will find it much harder to understand the feeling of other people. Physical contact. A number of children with ASDA do not like to cuddle or being touched like other children do. Loud noise. Some smells and lights also affect a person with autism. Speech. The higher the severity of the autism, the more affected are a person's speaking skill. Many children with ASD do not speak at all. Intellectual disability. Intellectual disability refers to significant sub-average general intellectual functioning which exists concurrently with deficits in adaptive behavior that adversely affects educational performance and becomes known before age 18. Intellectual disability was previously called mental retardation and can be categorized by below average mental abilities and lack of skills that are necessary for day-to-day living. Persons with intellectual disability can and will learn new skills, but they will do so at a slower rate. Common characteristics of children with intellectual disabilities are: everyone has their own personality and areas of ability and areas of difficulty. Generally, a person with an intellectual disability has difficulty 1. Learning and processing information as quickly as people without intellectual disability. They have problem grasping abstract concepts such as money and time. They also have problem understanding the stability of interpersonal interaction, and they may sometimes behave awkwardly or inappropriately in social action. They may also manipulating the ideas and concepts required for planning and organization. Supporting children with special needs through technology. According to DICORSA A 2018, technology makes it possible for a classroom to be enhanced with individual learning events, allowing instructor to provide greater flexibility and differentiation in instruction. Teachers can use technology to offer a variety of learning opportunities and approaches that engage instructions and support special education. The use of technology. Technology allows increase in independence. Technology allows children to learn at their own pace. Technology reduces anxiety level for children with disabilities. Technology simplifies communication and improves academic skills for children with disabilities. Facilities that make provision for children with special needs. In Jamaica, there are multiple problems in addressing special educational needs within regular classroom. However, there are organizations that help with special needs. Jamaica Association on Intellectual Disabilities, Microsoft Child Assessment and Research in Education, McCann Child Development Center, Early Stimulation Project, Caribbean Christian Center, Landila School and Special Education, Catherine Hall Primary Special Education Unit, and the Mario Trong Autism and Disability Foundation are all facilities that helps special needs condition. Provision for intervention for students with special needs. The Disability Act, which have been passed by Parliament, is necessary to give legal substance to advancement of special education service in Jamaica. The Transformation Unit of the MOE is working towards developing a comprehensive educational framework with a clear path that will take any child, including those with special needs, on a journey towards achieving his or her education potential. Solution being offered example differentiated instruction using various national tests to identify children with special learning needs and the A-STEP program. Types of intervention for students with special needs are inclusion. Children with different levels of disability are accommodated in all classes with support. Mainstreaming students. Join class for particular subject. Resource rooms. Students go to resource room. It already exists in public and private schools. Resource persons, special educators, reading specialists, guidance counselors are provided for children with special needs. You have schools and clinics, psychologists, nurses, and special educators also help with special needs children. I will now look at one technology software that can help with special needs. The use of technology in special education helps break the stigma for people with disabilities and provide them with access to the most relevant educational programs. Properly designed software and hardware allows students with special needs to get more modern education. The name of the software that can help with special needs is Text-to-Speech. The company that produces software is Assertive Technology. A brief description of the software. Assertive technology refers to the device and service that are used to increase, maintain, or improve the capacity of students with disability. As an assertive technology, text-to-speech (TTS) software is designed to help children who have difficulties reading standard print. Common print disability can include blindness, dyslexia, or any type of visual impairment, learning disability, or other physical condition that impedes the ability to read. However, other students can benefit from TTS technology, such as children that have autism, attention deficit hyperactive disorder, ADHD, or intellectual disabilities. Text-to-speech software can be especially helpful for students to retain more information through listening and reading. The software can assist students with monitoring and revising their typed work. Hearing the text read aloud assists students in catching grammatical error that may have otherwise gone unnoticed. In conclusion, teachers are often the first to detect disability or significant delay in children's development. Therefore, teachers can provide useful information that is necessary to determine a diagnosis to parents and families that have special needs. Teachers' careful observation provide evidence for children that have disorders such as autism and intellectual disabilities. By incorporating the use of technology and making recommendations and the use of hardware and software that can help with special needs. The parents of children with special needs are in need of a lot of psychological support. They may appear to be defensive or demanding, in denial and overprotective. They are often still working through the impact of having a child with special need. There are organizations and facilities in the country such as Jamaica to help special needs children. With special education needs in the classroom will perform best if there is a comprehensive intervention team including schools, clinic counselors, psychologists, guidance counselors, speech therapists. They will all help with special needs children.